Hospitals are again experiencing critical levels as whole families and more COVID-19 patients are overwhelming emergency rooms. The Philippines today recorded the highest daily count since the start of the pandemic. But how can transmission be reduced to lower the numbers? We discuss in this episode of the Chiefs. Welcome to this weekend edition of the Chiefs. Joining us tonight online are Ana Marie Pamintuan of the Philippine Star over there, and Lucy Cruz Valdez, the head of News 5, who will also be joining us in a few minutes. Ami, I would like to say happy weekend, but it's not going to be happy from what we see from the numbers. Yeah.
Hindi ba puro bad news?
Yeah. Well, of course, we are talking about today's numbers. The new COVID cases for today, they hit 7,103. That's the highest since the pandemic began in the Philippines.
Ever.
Yeah.
And of course, yung mga restrictions ngayon, mag-Holy Week pa naman. They're restricting a lot of activities and movement and travel.
Yeah.
So forget the grand vacation. Talaga naman hindi makaka-grand vacation, pero kalimutan mo na yung mga plan, pati yung capacity sa churches, binabawi sa 30. Although okay naman yun sa CBCP, okay naman lang sa kanila.
Yeah, and you know, I had a conversation just a few minutes ago in the previous program with the OCTA's Guido David, Professor Guido David, and he was saying their latest projections for the end of the month are now hitting 10 to 11,000 per day.
Oh my goodness.
End of March. Wala pa silang projection for the middle of April. You do remember last week, ang pinag-usapan pa natin last week, kung hindi magbago yung trend, we were only looking at mga 8,000 by the end of March and 18,000 by the middle of April.
Binago nila, ginawa nila 11,000 and then 20,000 by mid-April. Yung warning nila, baka lagi pa yung tumaas, no? Laki ng problema natin.
So there. Not a good way to start the weekend, but well, okay.
At least may good news tayo ngayong konti.
Let's put it aside for a few minutes. Let's go first into some good news. But we will go back to COVID in the second half of the program. So for tonight,
related na sa COVID, actually, di ba? Design yan eh. We're taking advantage of the lull in activities.
Yes.
Para ma-develop tong mga ganitong classes.
It's about spacing. It's about designing with spacing in mind. We begin tonight with landscape architect, our favorite urban planner, Paulo Alcazaren. A project of his, the Ortigas Elevated Walkways and Plaza, recently won the NCCA's 2020 Haligi ng Dangal for Landscape Architecture Award. Sir, good evening, and thank you for coming back. It's been a while.
Yeah, good evening, Ed. Good evening, Ami.
Yes,
nice to be back. I haven't seen you since last year.
Since last year. Kahit man lang Zoom, di ba? Dito nakikita.
Yes.
Well, sir, first of all, tell us about the design. I do remember before the pandemic, you were showing us plans. You were showing us computerized plans.
Yes.
I think that included this one, a part of which was already put up. If I recall correctly, tama ba?
Yes. The project that won for the NCCA Haligi ng Dangal is only a component of the larger master plan for Ortigas CBD. And this section was built by the city of Pasig, which is a 320 meter stretch of elevated walkway from the corner of ADB and Julio Vargas all the way to the end. And since there was no open space in Ortigas, we proposed that an elevated plaza be built, and it was built by the city to provide this node or this open area in the middle of the section. And the section will eventually connect Mega Mall on one end by EDSA and Meralco Avenue on the other end, and across to the call centers down below Julio Vargas. But this is just about 1/3 of a larger system that includes the Ortigas Greenway, which is funded by ADB and the DOTR, which has not been completed yet. The drawings and the design have been completed by us, but it is yet to see implementation. So this section, which we completed actually a few years ago, has seen much use, and people like it and in fact, it's very useful, especially in the pandemic, because it allows you. What we found out is that a lot of the commuters, once they get to EDSA MRT, a lot of them would have to take FX just to get to their offices inside the Ortigas Business District. But this system allows them, and eventually will allow everyone who reaches EDSA MRT to just walk in to the Central Business District, which is only about 500 meters from the EDSA MRT, and not have to take another ride, cutting their last mile commute to about 5 to 10 minutes instead of the 20 to 30 that they're now experiencing. So this one side on Julia Vargas cuts down a lot of the commute time for the last section of a lot of people's commute from the MRT or EDSA to their offices within the Ortigas CBD district. So we're really grateful that it's been recognized and given an award, and hopefully that will spur government to greenlight the other components of the system, because it needs to be completed if you expect everyone to walk. Theoretically, once you get to EDSA by rail or even by bike, you can just walk the rest of the way. Even if you were in a vehicle, you can park, and the plans are to construct multi-level parking garages at the edges of the CBD, much like what is happening in Makati CBD, the Central Business District in Makati, for which we are also involved. You can park at the many parking garages in the perimeter and actually walk all around Makati.
That'd be great.
Yes.
Sa Makati pa naman,
It's now,
hirap.
yes, in Makati, it's been a 20-year project since the early 2000s, late 1999 to early 2000s. We've been retrofitting that district to be more pedestrian friendly. And the lessons learned from there is being applied to Ortigas CBD. So it's not just us, it's several other consultants, but the concept is the same. Provide this elevated ground level and underground connections, so you do not need to ride a vehicle to do that last mile connection from your rail or train or bus to where you need to go. And if we had done it and completed this much earlier, it would have benefited more people. It would have provided more spacing, if you will, in that last mile from arriving at the district. The one city that has, in fact, completed its pedestrian system, or a good portion of it, is Iloilo. And we have seen in the last year, Iloilo was the most ready to support a pandemic method of circulation, and this is by walking and biking. Bike ridership in Iloilo, because of the provision of bike lanes, has increased several 100%, so that you could theoretically, you actually can go from where you live to where you want to work or shop in Iloilo by bike and by walking, because of the interconnected esplanades, which is already in phase 9, and also a lot of the internal streets. The bike riders in Iloilo have in fact organized themselves to a coalition and are working with the government of Mayor Treñas, and they've already done a full pedestrian and bike loop to provide connectivity for everyone in that city. So this one in Ortigas serves a couple of thousand people a day, and the good thing about it is that, of course, it's free. It's very user-friendly. There are escalators and elevators for PWD. In that picture, you see that yellow and black strip along the stairway. You can actually bring your bike up to the elevated walkway. And all of the elevated walkways in the Ortigas CBD, we have designed at about 4 meters. wide enough so that you can bring your bike and walk with it, or a folding bike, and hopefully eventually connect to the EDSA MRT. And like I said, if we had completed the system, that would have benefited much more people. The component of the DOTR got shelved a bit because of the reprioritization of the much bigger build projects of the government.
You're talking about the Ortigas Greenway section. You're saying this phase, this award-winning phase, should have paved the way for the completion of the Greenway section. Can you tell us more about it?
Yes, because what happened in the Pasig CBD is portions were completed and funded and completed by the City of Pasig in collaboration with the Business Owners Association, while the other component, which is the Ortigas Greenway, was an ADB DOTR partnership. ADB paid for the design and the engineering, which we did, and DOTR was supposed to implement it, but it was shelved. I believe because of the reprioritization of the much larger build projects, because apparently, well, our project, the Greenways, would have cost less than 200 million, and which probably seems too small for them to think about, but the benefit is really equivalent to building a skyway, and it's much cheaper. So I don't know what happened. I really are not privy to the prioritization process that they had, but they could build it in 3 months if they wanted, and it's a very low-hanging fruit, and benefits a lot of people very quickly. There are other initiatives by DOTR, which includes a connection from the Buendia MRT, pedestrian elevated connection from the Buendia MRT all the way to BGC, which is about 1 kilometer. And that has apparently also been awaiting funding, and they could have done it last year, but again, there are other projects in their build. If they wanted to, they could build it again in a few months. The only snag in BGC is the fact that it had to run alongside Manila Golf Club, and there were certain problems with of course, the membership of the golf club as to the privacy issues, which was addressed by the designers of the elevator. They consulted us on it, and it's very simple. You just put a visual barrier, and they can't see into it. There's no security problem. But again, it's a matter sometimes of it's always a right-of-way issue in a lot of these things, even for infrastructure for people.
Yes,
hopefully, the lesson we learned from this is that these are all good projects and will benefit us even without pandemic, but especially with the pandemic and in the new normal. We really have to spend not a lot of money, but prioritize this type of connectivity, because for one thing, a pedestrian system is 1/10 of the cost of a vehicular system,
yes, sir.
but will benefit everyone, because all commutes, we must remember, start and end with walking.
Yeah. So, sir, let me follow up on Ami's question, but although you did touch on it a bit a while ago, but I'd like to expound on it some more. What's stopping other LGUs from picking up on where you left off or where you began? Is there, by any chance, is there a greater risk involved here for developers or for LGUs? Is it more expensive? I mean, what's stopping us from pushing forward with this kind of a concept in other places?
Yes, in fact, just prior to the pandemic, we were approached for assistance by several LGUs, including Jensan, Zamboanga, Iligan in Cagayan, and the problem, of course, is that a lot of the priorities and focus of these LGUs is to combat the pandemic.
COVID.
So the infrastructure projects got shelved, of course. It's very hard to make decisions like this for monies to be spent. Other projects that involve money from CHIEFS and from DPWH had to be shunted towards the needs of the pandemic. But hopefully, once we get through this next surge, and I hope that soon, we can prioritize because there are budgets already allocated for improvements, and LGUs do have monies set aside because there's just so much you can do with the pandemic while we wait for the vaccines to come. I believe a lot of the LGUs and the Metro Manila mayors themselves have already prepared. It's just that we're waiting for the vaccines to come.
Paulo, apart from this project, we noticed in your Facebook profile, you've been posting photos of structures from old Manila, yung old Luneta Hotel, yung Balara filtration. What's behind us?
Yeah.
Is this related anyway to the pandemic?
It's not so much, it's nostalgia. People love that. But part of the nostalgia is for a city that was walkable. In the pre-war days, my father used to tell me stories, everything you can reach by taking the tranvia, the Meralco tranvia, and you could walk everywhere. Governor General Taft, when he was assigned here, used to walk from Malacanang to Intramuros, part of his daily regimen. And the old city of Manila was entirely walkable because of the fact that it was compact. All the buildings you need to get to are within 1 kilometer or so in the center. And if you had to go further, you just took the tranvia. And the tranvia connected Binondo with Intramuros all the way to Ermita and Malate up to Lasal in Taft. And as far north as Malabon. And you could even take an intercity link, which is like a larger tranvia, all the way to Makati and Camp McKinley, which is Bonifacio. But we lost that system, and then we started our dependency on cars, and that's when everything changed, and our focus for connectivity and access had to be car-based. So we lost the nostalgia for old Manila is a nostalgia for a city that you can walk everywhere to.
Well, apart from walking around, I want to ask you about this new trend. It's related to the pandemic. People are preferring al fresco dining, and even in the shopping areas, the commercial centers, they want the open areas. There's a very large one in the south. It's very popular. You think this is going to be irreversible, and what can developers learn from this?
Well, what we've learned, in fact, a number of the streets in Makati CBD have been closed on the weekends for alfresco dining. And it just proves the point that you, especially during the weekends when there's not much business traffic, you can actually shut down the streets so you can have alfresco dining in alternate streets. So, which brings us to the concept of shared streets. And right before the pandemic, we were doing a study for Poblacion that sought to address the problems of access by cars. And we found that we could close a good number of the streets so long as we provided for some parking at the perimeter. And the dining establishments will benefit from a streets are essentially fully pedestrianized. I mean, it allows the residents of the houses in Poblacion access, but most of the street, as in the streets in Northern Europe, in Denmark, Sweden, and are use the concept of Wonerf or shared streets. That means you have limited access for vehicles, but most of the street is used by pedestrians. That's what you see in a lot of the tourist destinations when you go to Europe, the small towns in Italy and France. They have shared streets, so it's a paradigm shift in how we, or going back to how we used to. That streets were really for people and not just for cars. Today, our streets are for cars and jeeps and buses, and the pedestrians are marginalized by this shift in focus to vehicular traffic rather than pedestrian traffic.
You think property developers are actually taking note of this, or they're just waiting for the pandemic to be over and everyone will go back to the air-conditioned commercial centers?
No, I believe a lot of them are already recalibrating and accepting the fact that the future will be a future where we have to anticipate the recurrence of some type of epidemic or a pandemic. And so a good number of us consultants have been approached by our clients, and we've recalibrated a number of township designs to allow for more space in mixed-use lifestyle centers exactly for that, to provide more space for outdoor dining, to allow for better pedestrian connectivity so you don't have to take a car everywhere. I think all of them are now anticipating a new normal where a premium would be, especially if you live in a dense condominium, premium will be the provision of enough open space so that if anything happens, you do have access to all of this amenities that in other cities would be normal, but here we have a lack of.
Sir, if you don't mind, sir, I'd like to pull back a bit, zoom out a bit, and ask you a bit of a more general question. Kasi I don't know if this is correct, pero di ba, I suppose urban planners and urban designers, they have to strike that balance between, designing around human behavior or designing to influence human behavior for the better. I suppose may ganung pagbabalanse. Let me ask you about that kasi we do want people to start walking. We want to encourage people to get on their feet and but at the same time, you have then problems sometimes with pedestrians who refuse to use overpasses, who would rather run across EDSA and all that. How would you suggest that we tackle these kinds of issues?
Well, first of all, I'll quote Winston Churchill, who once said of architecture, we build our buildings and we shape our buildings and our buildings shape us. Mm-hmm. So the physical environment either enhances or prevents good public behavior. So if what you design is bad, then you won't have good behavior. The problem with a lot of our infrastructure for people is that they're badly designed. Because most of the designers just are used to designing for cars, and people are relegated to second or third priority. That's why you have crossings across EDSA where you need to train as a mountaineer just to get across.
Mount Kamuning.
The Mount Kamuning. And then you have very narrow sidewalks because the standards are not set. So in fact, the Philippine Association of Landscape Architects are putting together standards for pedestrian design. So too with the environmental planners and even the architects for new normal designs. I just finished a seminar this morning on new protocols for health facilities to address future pandemics, and this is a multidisciplinary effort headed by the PRC to develop guidelines for Philippine hospitals and healthcare facilities to be able to design government and private hospitals to address any future needs. And it's very important that, and the key word here is design, because we have not developed our own standards. We always have to rely on foreign standards, or our standards are, like our building code is over 50 years old. We have not upgraded them, and now is the time. A lot of the associations have seen fit to relook all of the standards that we're currently using and make them fit for a future that we hopefully, that we can't anticipate at the moment, but we have to plan for. So yes, the answer is, if we design it properly, people's behavior will follow. If you want people to walk 500 meters, you have to make sure that they don't trip and fall while walking, that they have a shade over them, that they're protected from the rain and the sun, and they don't get run over by cars. So inside our buildings, which are world-class, you have all of the comforts of the 21st century, but once we step out of our 21st century buildings, we get run over by the Jeep. So this is the big deficiency we have in our shaping our physical environment, is that interface between building, street, and the public realm. and the needs of people and not the needs of cars. So the good thing is that a lot of us in the various disciplines are looking at it now because we have the time. The next step is to get the government to accept all of these new standards that we're setting. And like this morning, we were talking to the Department of Health, and we all know that it has to be done. And we all know that new standards have to be set. It doesn't mean that we spend any more money. It just means that we're designing smarter. So smarter design will lead to better design and hence better environment for everyone.
Okay, award-winning urban planner Paulo Alcazaren. Sir, congratulations and thank you for
Thank you
joining
very
us.
much.
Thank you.
Thank you.
Ingat po. We will just go into a break, so please stay with us.
The Health Department recorded 7,100 new COVID-19 cases today, the highest single-day jump since the onset of the pandemic. The OCTA Research Group projects that Metro Manila will see 4,000 to 5,000 new daily cases by the end of March. The group also warns that hospital occupancy in the NCR may reach 80% if the current trend continues.
I think the government now should look into this. The cases now is more or less higher than what we experienced before in last year's July or August. So this is the highest, and we don't want this to escalate more in the next 2 to 3 days because that will really overwhelm our healthcare facilities.
Welcome back to the Chiefs Show on One News. We are now in the final stage of our conversation, and now joining us are Professors Ranjit Rai and Guido David of the OCTA Research Group. Professors, good evening, and sir, pag kayong guest namin
Happy weekend.
hindi happy ang weekend.
Messengers of doom and gloom.
Well, sir, sige sir, let's start off with that. Kasi nga, I suppose nobody really expected the number to hit that high today. 7,103 today. And last week we were just talking about OCTA's projection na baka mag 8,000 tayo by the end of the month. With today's numbers, what are we looking at? Do we have any new figures for the end of the month and for the first week of April? Or first half of April?
Ed. The figures show na yung projections namin, they're still on track. So we will probably see mga 8,000 by sometime next week. I mean, that's the reality. Kasi at this height of the cases, mahirap i-reverse to. Hindi siya basta-basta mag-reverse. It has the momentum right now to increase. And we're gonna see most likely at least 10,000 cases per day by the end of the month. But, well, I was looking at the numbers and I saw a silver lining here.
Okay.
So it looks like a silver lining is if this trend continues by June 30, we will achieve herd immunity. So we will have infected
Sir naman.
8.5 million people in NCR that will give us herd immunity. So
Sir, your silver lining turns out to be a missile.
yeah, I mean, sorry. I mean, what I'm saying is,
I can't believe, at this time you can crack a joke. I can't believe it.
Prophet of doom.
no, but yeah, but these are actual projections na by June 30 we'll reach 8.5 million total cases if this trend reproduction number continues
In
until
Metro Manila.
June 30. Metro Manila, yes, that's herd immunity
That means
territory.
we
na.
have antibodies for 70% of the population of Metro Manila.
Yes, mauna sa vaccination natin yan.
Hawa-hawa na lang tayo.
Not a good way of getting antibodies, ha?
But you know na nag-impose na ng kung ano-anong restrictions ang government, no? Na sinara uli yung driving school, cinema, gaming arcades, museums, tapos binabaan yung mga capacity ng churches, yung mga conferences. Would that be enough to slow down significantly this spike?
I'm afraid na. Can you hear me, guys?
Yes, sir.
Can you
Yes,
hear
sir.
me?
Go ahead, sir.
Yeah,
Go ahead.
I mean, the next week or so, no. Actually, the next 2 weeks are a done deal already. This surge has a momentum. It's going to get worse before it gets better. But hopefully, if we introduce more mobility restrictions, we may actually slow it down. But it will come after a few weeks. The impact of these significant mobility restrictions. We're hoping that the hospital capacity will hold up. But our hospital utilization model, which by the way we will share with DOH and with others, shows that we only have a window of around 2 weeks. So maybe we will have to bite the bullet here. But if there will be a significant, some sort of circuit breaking effort, no, or lockdown is such an allergic word for everyone.
Yes, sir.
It could have a significant impact over the next 2 weeks. If we can, that's why we're now exhorting, we're now encouraging people. The government won't close down, and for many reasons, then we have to take it upon ourselves, as usual, no, to do a personal voluntary ECQ, meaning huwag na tayo muna lumabas. If we can all do that, and if those who have to go out work, like Ami who always works, no, and Ed, no, who are always out working, you can still work, and public transportation for our workers should be provided. Yeah, but the more of us, there's a big news, no, this afternoon. I think that there was a executive order or some administrative order that a significant portion of our government employees will be work from home. I think that's a step forward. That is a very good step forward. If we can do that for the private sector, maybe there's hope for us to slow this down in the next 2 weeks.
Pero Prof, kasi what you mentioned so far, these are voluntary measures. I mean, yung people stay home and all that. I'm wondering lang on the policy level, is there anything that you think we need to do? Kasi I do remember that before we were also talking about the possibility of, for example, slicing back on capacity, maximum capacity in transportation and restaurants and so on down the line. As a matter of policy or on the policy level, what can or should be done? What would you recommend that government do? Because yun kasi ang na-enforce talaga ng gobyerno, if at all. Yung voluntary kasi, of course, it's left on us, which is still a good thing, but iba rin yung may konting pulak.
I'll address that. No, yes. In fact, the strategy seemingly right now is to leave it up to local governments and individuals to fight this surge. No, there's some concessions made since yesterday, but we hope that we could get more. This surge is getting serious. Now we need to do a circuit breaking lockdown. That's what we're saying.
Yes, sir.
And we're suggesting a hard GCQ, going back to, we need more mobility restrictions. And if we can do it within the framework of a GCQ, where we still have some businesses open, a lot of businesses open, public transport is provided, so our workers, especially the manggagawa na arawan, can still get transportation. Then I think there's a lot of hope. I think we can create a dent, no, at least slow the R down.
Yes, sir.
But right now it seems like a done deal for I mean, this round, I think
For the next
it's
2 weeks,
going to go this week. No, this week, I think that it's going to go to the virus. No? It's gaining momentum. We're hoping that hospital capacity will hold up. I think, Gids, we have a window of what, 2 weeks?
Around 2 weeks until end of March for
Yeah, until,
NCR
yeah.
hospitals to get to 70%
Yeah,
critical.
so maybe that's...
Anong kulang dito? Because they're also reducing restaurant, coffee shop capacities, yung mga personal care establishments restricted to 50%. Ano pang kulang doon? Ano pang pwede gawin?
Siguro, Ami, kailangan muna right now, given where we are, maybe there's after some time we have to study the possibility of prohibiting all types of social gatherings just for the period of the surge. Maybe, and I love going to restaurants. I love going to restaurants, and I feel for the restaurant owners. Maybe in their dining, in particular, should be discouraged. And maybe, as Architect Paulo was saying, more limited outdoor dining can be provided. But who would like to dine at a time like this? And takeout should be encouraged. And it's not just them, it's all these other establishments that provide services were in enclosed areas. So at one level, malls will have to also reduce hours, and the thing that will, I think, help initially, maybe next week they can think about it, is making sure that everybody has a quarantine pass. Only those who need to go out should go out, and we should exercise that again. So going into an establishment, if you're not a worker or a person needs to go out because he has to serve his family, then you should be at home. If you're below 18 and you are elderly, you should be home. So yung nasa labas lang dapat talaga yung may quarantine pass.
Yes,
I know
sir.
it sounds simple, but these things, if we require, it will reduce mobility. The idea here there is to reduce mobility for a big chunk of the population. Working
sir.
population can still go. Last is private sector. The private sector is so crucial here. If a big chunk can work from home or through staggered work hours, rotation, that would be significant. And maybe putting all those things together, plus the personal voluntary ECQ, we might be able to slow this.
Yes, sir.
But
Pero,
it takes some time.
Yes, sir. Sir, yung quarantine passes nga do sound like a good idea, pero baka mahirap siyang i-implement on a per LGU basis kasi a lot of people work in one place and live in another place. Unlike before kasi buong Metro Manila yung naka-quarantine pass. So kahit papaano, you have the passes that you need to go from place to place. Pag baka pag per LGU medyo hirap. May LGU may Q pass.
What I meant is whatever quarantine pass you have, your family has. Dalawa lang naman binigay bawat pamilya. So gamitin na natin yon para yung iba na walang quarantine pass sa pamilya nyo, nasa bahay lang po sila. So yun yung panawagan namin. Yun ang aming call for our citizens here in NCR, that it's stay at home. It's a strict stay at home policy because the virus is raging. It's spreading all around. Now, we want to address the issue of scaring. No, it's not scaring. Everything that we projected is coming true. And we hope that with significant adherence to minimum public health, standards, and significant mobility restrictions, what government is doing now, and maybe more over the next week, we may be able to slow this down. So pareho yung combo. What we do as individuals and what government imposes as far as mobility restrictions are concerned. Our position is we need more.
So transportation, you want more restrictions? Any particular?
No, we're not. We don't believe that we need to restrict transportation. I think we've learned to live with this, and if there's strict sanitation, as well as strict monitoring and enforcement in transportation units. Now we have marshals who every now and then randomly choose buses and see if the bus company is enforcing yung minimum public health standards. I think we need to provide for our own workers transportation. we also believe in these bike lanes and all of these suggestions of our HPAC, for example, is suggesting bike lanes. I know Carl Chua is also a big supporter of this, so we can encourage that also. But the idea here is that we have to limit mobility for a big chunk of the population that's not part of the production system. So kung di ka nagtatrabaho, elderly ka, doon muna kayo sa loob. Kung mga bata, doon muna sa loob, stay at home muna. Yung mga lalabas lang, mga parents, mga nagtatrabaho sa bahay, and yun nga, they must follow the minimum public health standards.
Well, doctors, earlier you were talking about a 2-week window for hospitals. Could you explain that to us? What exactly does that mean?
Yes, what that means is if our projections are followed, or or if the projections are in line with what's happening with the trends right now, then we just have 2 weeks before the hospitals reach 70% critical care limit. So that's the critical threshold set by the Department of Health. So that's in the NCR. But right now we're hearing that many hospitals, many private hospitals are already full. Anecdotally, they're not accepting COVID patients anymore. Sometimes they're not even accepting other patients. So this is going to be a problem. And I just checked the latest data. I mean, 7,000 cases, pero 3,779 in NCR alone. I mean, this is really going to hit our, our worst nightmare. Yung projections natin, we could be seeing 4,000 cases per day right now by next week in NCR. This is unprecedented. We haven't seen this kind of surge in NCR. I mean, we really hope, we feel for our healthcare workers because they're going to be feeling, the strain of this surge. This is a nightmare happening to us right now. And to add to what Professor Ranjit Kunin said, if I'm going out, ang tingin ko ngayon, just to be on the safe side, I would treat everyone I encounter as potentially having the virus and act accordingly. I mean, I think that's the safest way. If you think that anyone you encounter can have the virus, then hindi mo na alisin yung face mask mo. You'll just, keep your face mask there. You could even wear 2 face masks if you're okay with it. Pero, that's the safest way. That's the safe play if you just want to protect yourself from getting COVID.
Yeah, parang suspect until proven innocent.
Exactly.
In a way. Actually, sir, magandang qualify ng doctors yung numbers ng NCR hospitals last week. While the numbers last week did not seem that alarming yet, pero they did confirm na napupuno yung mga big hospitals sa Metro Manila. And the big hospitals are the ones that are better equipped with more staffing. So yung mga hindi napupuno, yung mga hospitals na maliliit, which has less staffing and less resources. So that should also factor in whatever numbers that we have.
Right. And Ed, kanina we did a comparison of the hospital occupancy now compared to last August when we had the surge. Actually, mas marami ng hospital occupancy now in terms of beds occupied. It's just that the DOH and the hospitals were able to expand hospital beds and ICU beds. Dinagdagan nila, nadagdagan nila, na-scale up. Right. So, in terms of percentage, mas mababa ngayon. But in terms of the raw number, mas mataas na ngayon. And that shows na talagang this is a surge that's worse than last year because mas marami nang nasa hospital, especially sa ICUs. Our ICUs are almost at 70% critical level. Yung hospital beds, hindi pa. Pero yung ICUs were around 65, 67%. So, it's going to be problematic for many cases na yung severe or critical pag napuno na yung ICUs natin. And the best ICUs are in Metro Manila, and pag napuno na yun, where will they get admitted?
You're proposing a hard GCQ or a soft MECQ. In terms of numbers, at what point should we impose a hard GCQ? At ano ba exactly yon? And at what point can we go to soft MECQ? At ano rin yun?
When we proposed this, there was a context to it. On March 11, we met all the mayors of the NCR, and we proposed a GCQ, no, a hard, strict GCQ, going back to the GCQ of September, even with, the original GCQ strictures, no, lalo na with regards to restaurants, to indoor activities, salons, etc., with one with a revision, no, that certain activities will be discouraged, no, okay, and that a big chunk of, you see, in GCQ kasi a big chunk of the economy is already open. Most people can go back to work. So we were suggesting that we roll back that part of the regular GCQ structure and add another dimension by saying, okay, let's ask more people from the private sector and the public sector to stay at home. So a work from home arrangement. So that's why it's called the hard GCQ. But it still has transportation, establishments are still open, people still can go to work, okay? But certainly, we're discouraging all the other things that will, and the social gatherings are discouraged. Now, that was a week ago. So we're seeing that the need for us to take more drastic steps. I mean, that's at least our position. And that's why we suggested a soft MECQ. It's an MECQ with transportation. It's an MECQ where many business establishments will be open, but it's an MECQ where almost everyone will be working from home, and that not discouraged, but all activities, social gatherings, no, and these indoor dining, for example, out there will be prohibited na. So lahat na yon, and it will look like an MECQ, but it will be a little softer on many things like transportation. We'll still provide transportation for our workers. Businesses will still be open, and if they can't do the work from home, people can still go to the factories. The micro and small, medium enterprises are still open. So this is our own notion, so that we won't need to resort to ayuda for that, no. So street vendors can still apply and do their work, okay. So yun lang yung difference, but the majority of the population will stay at home. And maybe we need something drastic like that. Many of the countries that experienced the same thing, guys, also went through a lockdown. It's hard, no? But it's something that we need to accept up to some point, no? If we don't see any difference by next week, then maybe the decision has to be made. We need a circuit-breaking lockdown, okay? And that's how we're going to know.
Anong reaction sa proposal niyo for hard, for soft MECQ? Anong reaction? Pinag-aaralan mo or outright reject?
I think that nobody in their right mind will take it out of the equation as far as response is concerned. Right now our basic first option is a very strict hard GCQ, and it's hard because we're incorporating other elements that were not part of the GCQ. Right now we're not really in GCQ. No, we have to accept we're in a de facto MGCQ setup. And we're trying to roll back to a stricter quarantine classification in terms of stricter GCQ implementation. So that's our proposal for now, and hopefully by next week we'll assess. We're supposed to assess, Guido, when we propose it, we're supposed to assess it on Wednesday to see what the situation is. And if the R is still not going down, then maybe government should consider, and at least in our view, more drastic measures, no, to reduce mobility.
And obviously, you don't think 2 weeks will be enough, seeing the rate of transmission, the way this virus is behaving. Obviously,
see, there's a situation. We're in a situation now, Ami. We're trying to experiment with ways to stop it without curtailing the economy. But these strategies will take 2, 3, 4 weeks to see if it makes a difference. Now, while that's happening, our hospitals are filling up. So we have a small window before it overruns our hospitals. Now, we have to try to balance, di ba? Yes, it's going to do good, but it's going to have effect only after a month. Cebu is a very good example. It's been trying to fight its, Cebu City, I should say, its COVID outbreak. It surged, no, with no lockdowns, no, with granular lockdowns, but no citywide lockdown. But it took them 2 months, no, to see at least, no, a positive gain. Now we don't have that time in the NCR because our hospitals are filling up. If we had done this maybe 2-3 weeks ago, maybe we could have these more flexible arrangements. But we're confident in OCTA that government is seeing the same thing. That at some point, we will need a circuit breaker, similar to Singapore, similar to the UK, where significant mobility will restrictions will be imposed. I don't know what you will call it, if it's a soft MECQ, an MECQ, or even ECQ. But that's where we are now. The options are narrowing, and the need for us to act is becoming more urgent.
Yes, sir. Sir, I do remember last week there was a discussion on whether the surge is variant-driven, new variant-driven, or misbehavior-driven, or somewhere between the two. I'm wondering lang if could or should the cause of the surge be a major factor in the policy, in deciding what to do next?
Yeah, well, it's always important. I mean, Gibbs, what do you think? I think it is important. The doctors in our group are saying, yeah, we need to find out what variants are driving this surge. We need to ensure that these variants don't become dominant. We need to isolate. We need to test, trace, and isolate these variants. No? So it's important, But the thing is, the big picture is we're in the middle of a massive surge. That's going to affect lives and livelihoods. It's going to undermine everything we sacrificed and worked for the whole of last year. Whether it's we spent it cost us a lot, to reach this stage, and we were doing very good from September to December.
Yeah.
And it cost us thousands of lives. That was the most important thing. Trillions of pesos, because we had a very severe ECQ March last year. And now all of that, all of that sacrifice, all of those gains are going to be undermined simply because of this 1 month surge, in variant-driven surge. And because we have not decided how we're going to respond to it effectively. So if we delay the response, this will surely overwhelm us. Mm-hmm. And that's, at least I don't know, Professor David, we're not scaring people here. We're just saying, calling a spade a spade. This is emergency time, and we need to make a decision. In other countries, the simple moving of the R from 1 to 1.5 would have already, no debates, lockdown na kagad. But we understand in our situation, the economic and social costs are big. But right now, it's not anymore a dichotomy between lives and livelihoods.
Yes,
we're trying to deal with a crisis, a great disruption, and we need to make a decision quickly. A lockdown is needed, whether we call it a circuit breaker or, whatever you want to call it. We need some sort of response that will drive this surge down.
A more radical
significantly.
Response. Mm-hmm.
Yeah, and I think government is prepared to do that.
Okay.
Ami, you want to ask something, or are you good?
Ay, isa na lang. Kasi mag-uumpisa yung Holy Week Di ba? You think kailangan i-shut down yung mga simbahan or the 30% capacity is enough? Last year, nakasara mga simbahan.
Well, definitely that's something to consider. And I don't know what the discussion is between yung churches and the local government. Ideally, if we could forego this parang last year, because we had the translation, but it was a different scenario. Yung December, we had Simbang Gabi. It was a different environment. We were averaging only 400 cases per day noon. Now we're at 2,700 average. We just reached 3,700. I think it's a different environment now. It's a really much more serious situation. And I think they have to consider alternative options. We're not saying outright now they should, not have, mass or something. Maybe they could have it in reduced capacity, or even further reduced capacity, or forego some activities like yung mga singing. Pero I know they're very disciplined inside the churches, but I think at least maybe this time, maybe I know last year hindi na tayo nagkaroon ng Holy Week celebration, but I think they really need to reconsider, this upcoming holiday, because this is, this is serious. This is the worst situation we've been all this time. So, that should be a factor in their decision.
Yeah.
Yeah,
We are in a crisis situation, guys, and I think all of us will have to make our sacrifices now. And I think that church is the least of our problems. They've always, and they will continue to help the public and support measures against COVID-19. And knowing them, they would probably voluntarily, say that people should stay at home na lang and pray. After all, the goal is to prevent ourselves from getting infected. So the church will, knowing the church, they will make an adjustment. But really, the 30% will not cut it for us. We're trying to be nice about it, but we feel that we need more
yes, sir.
drastic restrictions. The decision has to be done within the next day. Government, society, prior together. We will overcome this surge if we are able to work together.
Yes, sir. Well, Holy Week nga naman is a time of sacrifice and self-reflection. It is not a time for socializing. So I suppose that should be the narrative that we should push forward. Maraming salamat, Dr. Guido David and Ranjit Rai. Sirs, maraming salamat for joining us tonight. At ingat po.
Thank you. Good evening.
That'll be all for this weekend edition of the Chiefs. We hope what was discussed here will keep the conversation going. Now, before we go, a reminder to our viewers, mask on, wash hands, and stay safe, Philippines. I'm Ed Lingao.
I'm not one of the Philippines. We are one.